In human physiology, there is a concept of safety factors. This concept is found in a variety of functionalities. What is the concept? The concept is a certain kind of cushion provided to a particular functionality. I mean, if this function gets deranged slightly, will it affect the overall homeostasis? Will it affect the overall functioning of the body? No. There is a certain cushion provided, and only when the physiological parameter surpasses that cushion or surpasses that particular value strength, only then a major disturbance is likely to happen. And therefore, that is the concept of safety factor for a few physiological parameters in the body, which we will now try to understand. Safety factor for edema. There is accumulation of fluid in the interstitium. That's a natural process. But what if there is excess accumulation of fluid? It results in the edema. But that's not very routine occurrence. Why so? We will see. There is certain safety factor which needs to be crossed, which needs to be surpassed, and only then it will result in a major physiological derangement and accumulation of fluid in edema. There are other safety factors in the body. For instance, safety factor for a propagated impulse. Impulse that is getting transmitted through the nerve, and those impulses have to be transmitted over a long distance. Over long distances they have to travel. There is a certain amount of safety factor so that the impulse transmission does not stop abruptly, even if there is some kind of disturbance in the milieu. Impulse transmission will continue to occur whenever needed, wherever needed. Safety factor for synaptic transmission. When impulse arrives at a synapse or at a neuromuscular junction, it has to cross that synaptic gutter, synaptic cleft, and there is a safety factor over there too, that if there are disturbances in the milieu, the synaptic transmission should not stop. So that safety factor for the synaptic transmission or a neuromuscular transmission. In this video, we will talk about the safety factor for edema, and then in the next video, we will discuss the other two. So let's talk about the safety factor for edema. To understand this, we will have to first quickly summarize the Starling's forces. The Starling's forces and the Starling's equilibrium acting in and around the capillaries, and which cause the movement of fluid into the interstitium or out of the capillary and back into the capillary. So let's first understand these Starling's forces. We all know that the capillaries in the tissue allow the fluid exchange, and certain substances also leak out of the capillaries, come back into the capillaries, and so on. For instance, oxygen goes out, carbon dioxide comes in, which is liberated by the cell, it comes back into the capillary. So lots of substances and fluid movement occurs across the capillaries into the interstitium. Let's understand these Starling's forces which act around on the capillaries, and they cause movement of fluid. Basically, there are two forces that we must understand. This is just a summary. This is just a quick summary so that we understand the safety factor for edema very well. Two forces which cause movement of fluid into the neighboring compartments. One, the hydrostatic pressure. One needs to understand 3 points about this. A, the hydrostatic pressure is a force that is exerted by the accumulated fluid. So, blood accumulated in the capillaries or interstitial fluid accumulated in the interstitium within a tissue outside the capillary. A. B, hydrostatic pressure, more the fluid, more is the hydrostatic pressure. That's the second point. More the fluid accumulated, more will be this hydrostatic pressure. And C, the third point is, this is a force that pushes the fluid away from it into the neighboring compartment, into the opposite compartment. Let me explain. If I say there is capillary hydrostatic pressure, what would it mean? It means the pressure exerted by the blood in the capillaries, more the accumulation of blood, more will be the capillary hydrostatic pressure. And here is a force that will push the fluid out of the capillaries into the interstitium. It causes filtration of the fluid out of the capillaries. On the other hand, if I say outside the capillaries into the tissues there is interstitial fluid, this is also an accumulated fluid. So therefore, this will also exert hydrostatic pressure. Interstitial fluid, hydrostatic pressure. Now remember, here is a force that will push the fluid back into the capillary. As we have already mentioned, hydrostatic pressure is a force that pushes the fluid away from it into the neighboring compartment. This I am putting in very simpler terms. Second force, which is acting in and around the capillaries, is the colloid osmotic pressure or colloid oncotic pressure. These terms are used interchangeably, osmotic pressure and oncotic pressure. Oncotic pressure is exerted by the macroglobulins or macromolecules, large molecules. Otherwise, these terms can be used interchangeably, the colloid osmotic pressure and or colloid oncotic pressure. Now, what do we know about this force? Colloid osmotic pressure is exerted by the proteins. And second point, colloid osmotic pressure is a force that pulls the water towards it, pulls the fluid towards it by osmosis. So, here we have inside the capillary the plasma colloid osmotic pressure exerted by the plasma proteins. And what is its job? It pulls the water into the capillary. As we said, osmotic pressure, colloid osmotic pressure is a force that pulls the water towards it by osmosis. So plasma colloid osmotic pressure is a force exerted, is the pressure exerted by the plasma proteins, and it pulls the water towards it, means into the capillary, back into the capillary by osmosis. Whereas even in the interstitium, in most of the interstitial fluids, in most of the interstitium, proteins have leaked out, and therefore they will exert what is called as interstitial fluid colloid osmotic pressure. Interstitial fluid colloid osmotic pressure is a pressure exerted by the proteins which have leaked out into the interstitium. And here is a force that will pull the water towards it, means pull the water out of the capillary by osmosis. It will pull the water towards it, means into the interstitium. So these are the forces called as Starling's forces. They cause movement of fluid in and out of the capillaries in the tissues. Let's understand a little further than this. These are the basic forces which are acting, but on the capillary, for the capillary, there are two ends of the capillary, an arterial end and a venous end. An arterial end which has all those four forces which we described just now, and the venous end. Those four forces are acting on both these ends. But the point is, on the arterial end of the capillary, the net balance of those four forces favors fluid to be filtered out of the capillaries. All four forces are acting there, but the net balance is in the favor of fluid to be filtered out of the capillaries. Capillary hydrostatic pressure and interstitial fluid colloid osmotic pressure. These two forces are pulling the fluid out, and they are greater than the other two forces like plasma colloid osmotic pressure and interstitial fluid hydrostatic pressure. So, fluid will be filtered out of the capillary on the arterial end. On the venous end of the capillary, the fluid goes back into the capillary. Why? Because those four forces, now they are acting on the venous end also. The net balance of those four forces is in the favor of fluid going back into the capillary on its venous end. Same four forces which we described, but here the net balance, the net sum is in the favor of fluid going back into the capillary on its venous end. So remember, fluid leaks out on the arterial end of the capillary, fluid goes back in on the venous end of the capillary. Last point, even more important, is that not all the fluid that leaks out goes back in on the venous end of the capillary. The net of all those four factors on the arterial end and the net of those four factors on the venous end, these two are not equal, they are not same, and therefore the net balance or net force on the arterial end is slightly greater than the net which is causing the net force which is causing the fluid to go back in. It's greater by about 0.3 mm of Hg. The net force that is causing the fluid to go out is greater by about 0.3 mm of Hg as compared to the net force that is causing the fluid to go back in on the venous end. And therefore, the point is, all the fluid that leaks out on the arterial end does not go back in on the venous end. Some amount of fluid accumulates in the interstitium and will become the part of interstitial fluid. So that is how interstitial fluid is formed, and that's how the fluid moves out of the capillary and back into the capillary. Next factor is the role of lymphatics. If the fluid filtration increases and accumulation of interstitial fluid increases, what's the way out? For most of the tissues, there is an accessory route called as lymphatics, lymphatic circulation and lymphatic channels. So, if the fluid accumulation increases in the interstitium, there is a lymphatic flow. It provides an accessory route by which this fluid can be drained out of the capillaries, and eventually that fluid is going to be drained into the venous system. The thoracic duct is a major lymphatic vessel which drains at the junction of two major veins. So the point is, lymphatic vessels will carry away this excess fluid, if any. The fluid will be carried away by the lymphatic vessels from these tissues. So here is a summary of the fluid formation in the interstitium. Now let's see what is edema and what is the safety factor for edema. Edema is accumulation of fluid, or rather accumulation of excess fluid in the interstitium. Excess accumulation of interstitial fluid is called as edema. Now, does it happen so easily that just a small derangement and the edema will occur? No. That is where we must understand the safety factor for edema. So that was the starting point of our discussion, the safety factor for edema. First point, what is the safety factor for edema? It is said to be about plus 17 mm of Hg. What I am trying to say is, the capillary pressure somewhere in the range of 9 to 10 mm of Hg will have to be almost doubled and should become 17 mm of Hg. Only then the edema occurs. So let's understand this safety factor for edema and how this figure has been derived, plus 17 mm of Hg. There are three sub-components in this safety factor for edema. First is negative interstitial pressure. Negative interstitial fluid pressure or negative interstitial pressure. Most of the tissues with a loose subcutaneous layer or loose subcutaneous tissue has the interstitial fluid pressure in the negative range, -3 millimeters of mercury. What is the advantage of this? The advantage is it provides some kind of a suction and it holds the tissue together. That's the benefit of this -3 mm of Hg, the negative interstitial fluid pressure or negative interstitial pressure. Now, because of this negative pressure, the tissue is said to have a low compliance for the accumulation of fluid in the interstitium. Due to this negative pressure, the tissues have low compliance for the accumulation of fluid in the interstitium. Let's try to understand how and why. When fluid starts accumulating in the interstitium, because of this negative interstitial pressure, what happens is just a small change in the interstitial fluid volume, just a small leakage into the interstitium and a small increase in the volume will cause a huge increase in the interstitial fluid hydrostatic pressure. Interstitial fluid hydrostatic pressure increases tremendously for a very small increase in the volume of fluid that has leaked out. So this is a low compliance. Large pressure change caused by a small volume change is said to be a low compliance. The point is just a small accumulation of fluid causing a huge increase in interstitial fluid hydrostatic pressure. This is because of that, mind you, the negative interstitial fluid pressure to begin with, -3 mm of Hg. So what happens is, let's recall that here is a force, the interstitial fluid hydrostatic pressure is a force that pushes the fluid back into the capillaries. So imagine fluid started coming out and a small increase in volume causes a very large increase in interstitial fluid hydrostatic pressure due to that low compliance that we described. That's a low compliance of the tissues to accumulate the fluid. And this large increase in the interstitial fluid hydrostatic pressure, remember we said here is a force that pushes the fluid back into the capillaries. So the fluid accumulation cannot increase. Just as some fluid came out, it caused a huge increase in interstitial fluid hydrostatic pressure. And that force, as we all are aware, is pushing the fluid back into the capillary. So it's not allowing the fluid to accumulate really in the interstitium. And this is because of that small negative interstitial pressure to begin with. It holds the tissue together. At the same time, it provides a very low compliance for fluid accumulation. This part must be understood clearly. Small increase in volume of the fluid causing a very large increase in interstitial fluid hydrostatic pressure, and here is a force that pushes the fluid back into the capillary. So in a way, it's not allowing the fluid to accumulate much. It comes out, it comes back in. So now let's come back to the safety factor. Minus 3 mm of Hg is the pressure. That means the interstitial fluid pressure has to increase by 3 mm of Hg and should become 0 or above 0, or it should become positive. Remember, if the interstitial fluid pressure becomes positive, then the compliance of the tissue is going to increase. Compliance of the tissue is going to increase, and then the situation will be reversed completely. So lot of fluid will start coming out into the interstitium for a very small change, very small increase in the interstitial fluid hydrostatic pressure. Remember, compliance is a pressure volume relationship. So when the interstitial fluid pressure becomes positive from minus 3 up to 0 and even positive, the tissue's compliance to accumulate the fluid is going to increase, and that will result in edema. So that's the first factor. What I'm trying to say, what I'm trying to suggest is that this 3 mm of Hg is one cushion. From minus 3 to 0, when the pressure increases, that's when the tissue's compliance is going to increase and fluid will start accumulating in big amounts. It will be the start of edema. So that's the first safety factor, 3 mm of Hg. Second safety factor for edema is the lymphatic flow. Whenever needed, the lymphatic flow, we all have already discussed this, that the lymph carries away, drains away the excess interstitial fluid. So lymph flow can increase by 10 to 50 times its normal rate. Lymph flow can increase tremendously whenever needed. That's the second safety factor for edema. So whenever the fluid goes on accumulating, let's assume that that first factor was crossed, overcome, interstitial fluid pressure has become positive and fluid starts accumulating in the interstitium. Lymphatic flow can increase tremendously. The lymph flow will carry away the excess interstitial fluid It will not allow the edema to occur by increasing the flow of lymph. Lymph will carry away that excess fluid. So this is the second safety factor, and it has been calculated that this factor provides a cushion of 7 mm of Hg. It has been calculated that lymph flow can be a cushion against edema. It's a safety factor against edema by a factor of about 7 mm of Hg of pressure. And the third factor is the draining away of the proteins. Draining away or wash away of the proteins. That's the third factor in the safety factor for edema. Let's understand this. Proteins leak out in the interstitium. In most of the tissues this happens. And proteins exert what is called as colloid osmotic pressure. We also seen that. And colloid osmotic pressure is a force that pulls the water towards it by osmosis. So, wherever proteins have leaked out in the interstitium, they will exert what is called as interstitial fluid colloid osmotic pressure. And interstitial fluid colloid osmotic pressure will pull the fluid out of the capillaries towards it by osmosis, means out of the capillaries into the interstitium. But here is a safety factor. The tissues and their lymphatics have a tremendous capacity to drain away the proteins. So even if proteins have accumulated in whatever quantity, those proteins will be washed away. They will not be able to exert the interstitial fluid colloid osmotic pressure. And therefore this force, which is pulling the fluid out of the capillary and favoring the accumulation of fluid in the interstitium, that will be provided a certain resistance. I mean, there is a cushion that the proteins are washed away, not allowing this force to rise and not allowing the fluid, more and more fluid to come out and accumulate as edema. So this washout, this washing away, wash off of the proteins and not allowing this pressure to rise has been calculated to be a safety factor of about plus 7 mm of Hg. So this is the third cushion, third factor, which provides us a certain kind of safety against edema, certain kind of cushion against edema. And it has been calculated that it's in the range of about 7 mm of Hg cushion provided by this particular factor, the draining away of the proteins from the interstitium. So we had negative interstitial pressure, which provided us the cushion of 3 mm of Hg, means the pressure is minus 3, but it has to increase by 3 and come to 0 and above 0. When it starts becoming positive interstitial fluid pressure, fluid will start accumulating. Then we had lymphatic drainage, which can increase by about 10 to 50 times is its normal flow rate, so that it gives us a certain cushion against edema by about 7 mm of Hg. And the third one is the draining away, wash away of the proteins in the interstitium. This can also increase tremendously, so that interstitial fluid colloid osmotic pressure does not rise. It does not pull the water or fluid out of the capillaries into the interstitium to cause edema. So all this adds up to 17 mm of Hg. This is said to be the safety factor for edema, and it is said that the capillary pressure, which is on an average, capillary pressure is in the range of 8 to 10 mm of Hg. That has to increase to 17 mm of Hg or more, only then the fluid will start accumulating in the interstitium. So that is the safety factor for edema. The capillary pressure has to increase that much more, almost more than double, in order to cause accumulation of fluid in the interstitium and edema. So that's the concept of safety factor for edema. In the next video, we will also understand the other safety factors for impulse propagation and safety factor for synaptic transmission.